Tuesday, March 31st, is International Transgender Day of Visibility, and our service today hopes to raise awareness about discrimination faced by transgender people worldwide. In this time of global illness, our own orders here in California to stay at home, I want to invite you to remember that of the many challenges we face in the weeks ahead, one of those challenges is trying to ensure equitable health care for marginalized peoples. Transgender healthcare has a complicated history. Until fairly recently, being transgender was classified by the medical community as a mental disorder. In 2013, just in 2013, the term gender identity disorder was replaced with the term gender dysphoria. This was considered a major milestone in helping remove the stigma from being transgender. One of the most significant markers of improved healthcare for transgender people was the creation in 1979 of a document outlining the standards of care for the health of transsexual, transgender, and gender nonconforming people. This document, now in its 7th edition, comes from the World Professional Association for Transgender Health. Healthcare for transgender people and respect in the medical system for the wide variety of gender identities has improved greatly over time. But there is still cause for concern and anxiety for transgender people in interacting with healthcare systems. It's not unusual for transgender people to be reticent about seeking healthcare because of fear of having difficult interactions with doctors and other health professionals. So, for example, the National Center for Transgender Equality has recently posted a list of what trans people need to know about COVID-19. That list includes a section on legal information that transgender people will want to keep on hand, which includes phone numbers for Lambda Legal and the National Center for Transgender Equality, court orders for name or gender change, any identification that shows the chosen name and gender, including passport or school ID. And if a transgender person doesn't have identification that matches their gender, a letter from their therapist or doctor, if they have one, about their gender identity. So this kind of list, as part of a big list of things to know and keep on hand for COVID-19, points to the kinds of challenges that trans people face when they seek healthcare. Challenges in having their gender identity recognized and honored. Now I want to talk about a term that some of you may not be familiar with, and it was new to me too. The term is minority stress, which refers to the chronically high levels of stress faced by members of stigmatized minority groups. It may be caused by a number of factors, including poor social support and low socioeconomic status. Well understood causes of minority stress are interpersonal prejudice and discrimination. So what I want you to know about minority stress this morning is that it is linked to negative health outcomes. Recent evidence suggests links between stressors and physical health disparities in LGBT communities, including cardiovascular disease, asthma, diabetes, and some cancers. So as I understand it, minority stress is a fairly new theory, and there appears to be much recent research exploring these ideas. But you hear what I'm saying. There is evidence that just the fact of having a minority identity, such as being LGBTQ or being African American, brings with it enough stress to have an impact on one's physical health and well-being. And as we are facing a public health crisis, where having existing health conditions is an added vulnerability, we might expect to find, when we finally have data to look at it, that marginalized peoples may be disproportionately impacted by this virus. Additional factors that will impact minority groups. A recent article in New Social Worker magazine notes, at a time in which it is vital to society for a person with symptoms of COVID-19 to seek medical testing and treatment, it is possible that a member of a gender minority may attempt to self-quarantine rather than risk being mistreated by medical staff. This may prevent them from getting the care they need, which can increase the risk of permanent damage or death. The article goes on, I'm quoting, in addition, it is very common for gender minorities to be ostracized by their families of origin. As a result, they may not be receiving the emotional support we all want during the time of a worldwide pandemic. Those who have created their own families, called chosen families, may not be able to get to them as a result of the bans on travel and the closures of community gathering spaces. Plus, some states are trying to pass anti-transgender laws even during this COVID-19 pandemic. Understandably, this can make a person feel personally attacked at a time when the world is being attacked by this virus. The result can further the stigmas, fears, and needs of gender minorities. That's the end of my quoting that article. So why am I telling you such bad news when we are already swimming in bad news? Unfortunately, not only are we living in a time of panic and fear, but we are suffering from a lack of information. We are not really going to know or understand what's happening now until it's all over, until time has passed, and until journalists and historians start to collect data and stories to make sense of it all. We can't afford to wait until then to know that our friends and family who are transgender and who hold other marginalized identities are more at risk because of their minority status. In this time when we are all feeling so vulnerable, we need to remember that some of us are more vulnerable than others. And it does not hurt us to know some of the challenges and hurdles that lay ahead. This is my way of honoring Transgender Day of Visibility, to make visible the problems and challenges transgender people may be facing in this time of communal illness. So let's take a breath together. And just hold that for a moment, those challenges, but also feel your compassion, our love for each other. Let that fill you, fill your heart. Those warm colors of compassion and love. And know that we do have the love, compassion, and care for each other to make a difference in how we, in what happens next. Well, this was our first full week since Governor Newsom's stay-at-home order went into effect on March 20th. So I don't know about you, but I could feel my anxiety increasing throughout the week. I'm learning that the hardest part of the day for me is in the evening when I'm tired and the news I've been reading kind of piles up. And then I start to think about specific people I'm worried about and how devastated I would be if something happened to them. Remember my message from last week? We need to stay in the present. When I start to think too far ahead, imagining what terrible things might happen, I know I need to go to bed. I need to be focused on today. Last week, I also mentioned that I have a daily goal of going for a walk, but I'm gentle with myself, and if I don't take the walk, that's okay. That's what I said last week. Well, I've realized that the walk is not really optional. I need to take a daily walk to support my mental health. Studies show that exercise improves mental health by reducing anxiety, depression, and negative mood, and by improving self-esteem and cognitive function. So my daily walk is important. And I've heard from so many of you that you are either sleeping well because you're exhausted, or that you're sleeping really poorly because you have so much on your mind. So both situations are absolutely to be expected right now. For many of us, our lives have been turned completely upside down, and everything that was familiar and routine has gone out the door. So of course we're exhausted. We're having to use enormous amounts of energy figuring out everything. Just deciding whether or not to go to the grocery store can feel like an enormous decision. And the fact that something like that, something that used to be so simple, is now a big decision is also why some of you may be sleeping poorly. It can definitely be hard to relax enough to sleep. If you don't have a daily spiritual practice, now is a good time to start working on one. Meditation, prayer, journaling, yoga. It is perfectly natural that we will have times of feeling anxious and fearful and sad. And a spiritual practice will help us find our center again when we are feeling overwhelmed. And finally, now is perhaps a good time to really think about how much news you need to read to be informed. Let me say that a different way. You might need to read the news less. We are mostly confined to our homes, which is an unusual situation, and reading bad news from all over the world is not really going to help us get through this. It's not a coping mechanism, and it's not a helpful practice. As I mentioned earlier, I think there will be lots that we won't know or understand fully until later, when this is all over. So all that information will still be waiting for you to read and digest in the future. Don't worry that you will miss something important. For me personally, I'm going to try and stay focused on the news from one local paper, the Union Tribune, and one national paper, the Washington Post. I'm not saying I won't read any other news. It's hard for me to unplug from the news, as I know it is for many of you. But what I want to do is to let the two news sources I've selected do the work of curating the news for me. If I need to know it, it is in one of those two publications. We are in hard times, and all expectations are that things are going to get harder. We can't know what's going to happen. No matter how much we wash our hands, and no matter how careful we are all still at risk for getting sick. What we can do while we wait to see what will happen is to offer as much love and support as we can to each other, to our friends and family, to our neighbors, to anyone we're in a position to offer love and support to. May it be so. There is a crack in everything. That's how the light gets in. May you go forward knowing that life is fragile and a gift, that you are lovable and loved, and you are not alone. Love and blessings to each of you.